have diabetes. How might that affect my vision?
So diabetic retinopathy is one of the most common reasons that people lose vision during working age. It starts with some small changes in the blood vessels in the back of the eye, usually after you've had diabetes for at least 5 years. And some of those blood vessel changes can cause leakage of fluid in the center part of the retina called the macula. And when that happens, people might notice some distortion in their vision or some reduction in their central vision. Later on in the process, if there's loss of some of the small little blood vessels, the capillary bed in the back of the eye, the retina decides to essentially grow new blood vessels that are friable and weak, and those can break open and bleed. And when those blood vessels break open and bleed, you'll see many floaters potentially, or if it gets worse, you might have loss of vision from that bleeding inside the eye.
How can I manage my diabetic retinopathy?
So it's very important if people have diabetes that they control their blood sugar, their blood pressure, their cholesterol, and that they don't smoke. And then the other important thing is that they get their eyes examined once a year to make sure their diabetic retinopathy hasn't progressed and that they don't need therapy. We have many therapies for diabetic retinopathy these days that are very effective, and if given at the right time, they can prevent vision loss.
What treatment is available for diabetic retinopathy?
Well, there are many treatments available. So the most historic treatments for diabetic retinopathy were doing lasers or surgery where we took the blood out of the back of the eye and then did lots of laser on the side part of the eye. The past 15 to 20 years, there have been new drugs that have become available that basically stop the blood vessels from growing in the back of the eye and stop the abnormal blood vessels from leaking fluid into the center. And so these are very exciting drugs that work very well. The downside to these drugs, though, is that they need to be injected right inside the eye, which is certainly a daunting idea for many patients, especially the first time. But the drugs are very effective, and the process can be relatively pain-free and simple for most patients.
How has technology changed retinal surgery?
Historically, retinal detachments and diabetic retinopathy with vitreous hemorrhage was repaired using vitrectomy surgery that used large gauge incisions. These required sutures and a lot longer for the recovery. More recently, we've developed small gauge, minimally invasive surgery where we don't even use sutures to close the wounds because they're so small. And these people have less surface discomfort after the surgery and typically have a relatively painless journey through their post-operative care.